Moderna is the latest to produce a vaccine that appears to be highly effective. But has Canada figured out who gets access to a vaccine first and how? Anita, Anand, the minister in charge of procuring vaccines for this country, is standing by to answer those questions. As well, President-elect Joe Biden warns Americans if Donald Trump doesn't give him access to intelligence briefings, that country's COVID-19 response will fall behind. The CBC's Katie Simpson will have the latest for us from Washington on that. Then Beijing tightens its grip on Hong Kong, raising fears the region's pro-democracy movement is in peril. We'll ask one prominent activist in exile what the international community and Canada specifically can do to ensure its survival. First, though, more on that news about Moderna's vaccine candidate. Today, the company said clinical trials show the vaccine is nearly 95% effective. Canada currently has an agreement for 20 million doses with the option of buying 36 million more. When might it be available to Canadians? For more, I'm joined by the Minister of Public Services and Procurement, Anita Anand. She's joining us from just over the river in Gatineau, Quebec. Hi, Minister. Good to see you as always.
Great to see you, Vashi. Nice to be here.
Thanks for being with us. Let's start with Moderna specifically. So I mentioned the number of doses that you've already procured with the option for more. I should tell our viewers that it's the same as the last vaccine in that, and correct me if I'm wrong, you need 2 doses per person. So right now if you have 20 million doses, it's for 10 million people. The 36 million doses that are optional, or you have the option for, is that contingent on, let's say, Public Health Canada approving the vaccine?
Well, there are many considerations that go into a decision as to whether to exercise options, and Health Canada approval is certainly one of them. Delivery dates are another. And so we're continuing to follow the science. We have to remember, Vashi, that Pfizer and Moderna, as well as the other 5 candidates that we have access to under our procurements, are still in clinical trials. This is a very complex environment, and we have to be careful to follow the science. And part of that is making sure that the independent regulatory process undertaken by Health Canada is allowed to take its course. And we will be following that process very carefully, of course, but it's not a political process. And so we have these agreements in place, but very much focused on Health Canada approval and when that occurs. And then everything will fall into line after that.
It's not a political process, but in other countries, there are levers the government can pull to expedite the process. For example, additional resources or extraordinary measures allowed for Health Canada, for example, in this instance, or whatever regulatory body it is, to really focus all their attention and expedite the process. Is that something that's going to happen?
The jurisdiction of Health Canada, of course, isn't under my portfolio at all, but I understand that there is that work going on with the Minister of Health and the regulator. But again, we should remember that rolling reviews of AstraZeneca, Pfizer, and Moderna have already begun as of October, and everybody is focused on the need for speed in this area. However, again, we want to make sure that we're following the science. That's what's going to keep Canadians healthy and safe, and will lead to an effective vaccine at the end of the day. There are still scientific questions, Vashi, that need to be answered. For example, some vaccines are likely to be more effective in certain population groups. And we don't know that yet. The science needs to evolve, and we need to allow Health Canada, as well as these vaccine companies, to do their jobs prior to any distribution to Canadians.
I imagine it's that kind of stuff that you mentioned that will factor into kind of who gets populated by which vaccine. But in a more general sense, Minister, I'm wondering if, since you are procuring these various vaccines, is it possible that there ends up being a mix in the country? So, for example, some parts of the population will receive one vaccine if ultimately it does get approval, and other parts of the population might get a different vaccine.
Well, I'm sure that there are various options on the table. You have to remember also that while we have 7 agreements in place, leading and allowing us to have up to 414 million doses if you count options, there are different types of vaccines. The mRNA, the protein subunit, and the viral vector vaccines, for example. And the science is still evolving as to which of these different types of vaccines will be effective on which populations. For example, pregnant women. Would different ethnic groups fare better under certain vaccines? Those are scientific questions that, of course, as procurement minister, I don't have the answers to, but I, in our purchasing, in our procurements, are following the advice of the scientists, the Vaccine Task Force, the Public Health Agency of Canada, etc.
So I know you're still waiting, I guess, on that science, but I think it's fair to say that Canadians are understanding of that need to wait, but also anxious to find out and have heard now from various premiers that they're working on plans how distribution will work. What is the status of sort of the federal government's work on that, and when do you anticipate Canadians will have some more concrete answers?
Well, we're working very hard on that. And let me just say that it's really important to recognize that there are different stages of this plan. The first is the regulatory approval process, which I've already alluded to. The second is the biomanufacturing process, which we are aiming to have some occur in Canada. We've invested $126 million in the NML facility in Royalmount, for example, which will allow us to provide some of the finishing phases of the vaccine production process right here in Canada. We've invested $173 million in Medicago out of Quebec. And so that phase is continuing. We've also purchased 3 machines from VanRx in Burnaby, which will allow us to do fill and finish here in Canada. The third phase, the distribution phase, is the one I believe you were highlighting in your question. And of course, that's important too, especially when you think that Pfizer needs to have its vaccine stored at minus 75 degrees Celsius. Moderna also needs to be refrigerated. To that end, we have put in place contracts for refrigeration, which would allow us to have 133 million doses or so refrigerated. So we are working on that logistics chain. We have already heard from a number of manufacturers and other suppliers regarding refrigeration, regarding transportation, regarding warehouse and distribution. So those are contracts we're putting in place as we speak, Vashi. And then the final phase is the administration phase. And we have put in place a number of contracts already, 90 million syringes. We've purchased 100 million needles, sharps containers, 90 million swabs, etc., so that we can support the provinces and territories when it comes time to administer these vaccines.
So sorry, just to clarify, you mentioned the 133 million doses that will be able to be refrigerated. I know there's a difference between Moderna and Pfizer. Pfizer needs to be stored at a much colder temperature and requires a certain type of freezer. Have you procured all the freezers necessary? Is that what you're saying, or are you still on the hunt for them?
Well, we have secured the capacity to safely store approximately 33.5 million doses at a time. We've built in ultra cold and cold chain storage into those contracts. And moving forward in the final stages of the procurement process, we are working to secure a vaccine logistics provider so that we will be able to have some assistance on the ground with distributing these vaccines.
Okay, one quick question before I let you go, Minister. The Chief Public Health Officer in Toronto today said that a vaccine could come to Toronto in the first 3 months of 2021. Does that timeline jive with your understanding?
So, as I said, all eyes are on the Health Canada approval process. And we need to make sure that that's what we're focused on. Of course, in our procurement contracts, we have delivery schedules that would see vaccines coming into Canada in the first part of 2021. But it's complex, and there are many scientific questions involved that I have alluded to here. And so I prefer to focus on the date of the approval of the Health Canada as regulator, as opposed to when the vaccines are going to be distributed on the ground, because the second thing cannot occur until the first thing does.
Okay, Minister, I'll leave it there. I appreciate your time as always this evening.
Thank you so much, Vashi. Take care of yourself.
Anita Anand is the Minister for Public Services and Procurement. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.